Rule number one in cardiology, everything in moderation. The reason we care about high blood pressure, cholesterol, diabetes is that the cumulative long-term effect of them being uncontrolled for a longer period of time increases your risk of heart attack, stroke, death. In the outpatient routine management of these conditions, I'm thinking in the long-term perspective, in a 5, 10, 15, 20 year viewpoint. It's just like a good investment or really bad debt, that in 20 years you'll have a lot more money or be in really bad financial trouble. Similarly, the choices you make today can impact your health in the future in a very positive or potentially negative way. And just because you have those conditions doesn't mean you're going to have a heart attack. Just because you don't doesn't mean you can't. And again, every patient's different, but I know that if my doctor told me I can never have steak ever again, I would either lie or find another doctor. Certainly, there are exceptions to everything, and not every patient's the same. A lot of these conditions are the cards you're dealt and how you play them, meaning your genetic predisposition to developing them, and the few things that are in our control that can impact it. For instance, in high cholesterol, we always talk about red meat consumption or the right type of fat or eating baked foods, which is better than fried foods. But just because you don't do any of the bad stuff or do everything right, you could still just be dealt the wrong cards in the genetic gene pool and still develop that. I have patients who are like the healthiest specimens in the world, and they still develop high blood pressure. Not because they did anything wrong, but just because the human body isn't perfect. So certainly, you should not smoke. You should eat a healthy, balanced diet. You should exercise regularly. Try to sleep well. All the usual things that our moms were all right about. Brush your teeth. Look both ways before you cross the street. But for patients who are like me, who enjoy a steak every once in a while, don't freak out about it. Everything in moderation. Except for smoking. No smoking.